Oh yeah, fine. Well, I can do it myself.
Well,
Up to you.
at least I wanted to say that I invited T, as he goes by, T, because he was my host when I did a Fulbright in 2019. So in 2019 May, I visited him at University Tunku Abdul Rahman in outside of Kuala Lumpur in Malaysia, and he was a wonderful host, and we had a a great time, I think. Um, So then we've actually continued some work. There's a paper that's come out of that. It's been submitted. And that's on one of the topics that he's interested in. That people might be familiar with sound from video. So that's one of the topics, but today he's going to be talking about his work with medical imaging, and particularly a type of MRI that he's trying to make very useful for, I guess, deeper medical applications. So, Dr. T, please.
Hi, thanks for the introduction, Tony. Nice to see and hear from you again. So, good morning, everyone. So just to let you know that I'm actually in Malaysia. So now it's about 3:30 a.m. in the morning. So if you cannot understand me, I blame that I'm feeling very sleepy. So please feel free to stop me if you don't understand anything or you have any questions during the presentation. So thank you for the introductions and thank you for the invitations. So very quick introductions about myself. My name is Yikai T. You can call me T. I'm actually an assistant professor and also the chairperson of Center of Healthcare Science and Technology in University Tengku Abdul Rahman, Malaysia. So let me change the pointer. Okay, so this is the pictures of the research members in my research center. If you have any questions now or later, please feel free to email me. Quick introductions about the faculty that I'm in. I'm actually in the Lee Kong Chen Faculty of Engineering Science. This is the building that I'm in. Then our main campus is actually in Kampa. So this is the Kampa main campus. A little bit introductions about Utah. Utah was set up or established in 2002. Started with 411 students. Then it started to grow, and then as of February 2019, we have about 23,000 plus students. Then we have about 122 programs based on some of the latest ranking in the world. We are actually currently number 2 in Malaysia. So this just a very quick introductions regarding the university that I'm in. So back to the topic for the talk of today. So how MRI can be used in acute stroke and also cancer diagnosis. So before I go straight into the topic regarding CEST MRI, I just want to give you a brief introduction regarding how MRI actually image the body. So I'm not sure whether the audience have learned about MRI or know about MRI. So I decided to give a very quick and brief introductions regarding how MRI actually works before I move into the more advanced type of the MRI technique, that is CEST MRI, which is what I'm going to talk about more later. So let's look at how basic MRI actually works first. So this is the outline for my presentations today, and this is the topic of my presentations. So I'm going to give a quick introductions to MRI. Then I'll move into the main topic today, basically what is CEST MRI, and then the potential of CEST in stroke management, and also the potential of CEST in cancer. So when you talk about MRI, we are actually dealing with the hydrogen protons in our body. So if you look at it, human body is about 60% of water, and then there's another 20% of fat. So water and fat, they actually consist of a lot of hydrogen protons. So basically, if you look at human body, it is about 83%, roughly 83% of the body weight is actually hydrogens. Then hydrogen has a spin and actually can experience resonance. So it means that when you apply a radio frequency pulse to the hydrogen protons, you can actually make the hydrogen proton to change or tip to a different directions based on the radio frequency pulse that you apply. So in MRI, when you talk about MRI, they are actually trying to affect the spin of the protons in our body, because 83% of the body weights are actually hydrogens. That's why you get a very strong signal. We call it hydrogen signal or water signal coming out from the MRI. So imagine this is the MRI scanner. So you have a MRI scanner that uses a very powerful magnet. Once the subject lie on the table and then go into the MRI machines, because it has a very strong magnet here, all these protons will actually align with the main magnetic field. And then some of them will be against the main magnetic field as shown here. So when you try to sum up this magnetic moment, you're going to get a net magnetizations, because majority of them, they'll be aligning with the main magnetic fields. Some of them will be against the main magnetic field. So against means that they are actually pointing in these directions. They are aligning it with the main magnetic field, meaning they are pointing in these directions because your magnetic field is actually in these directions. So when you try to subtract the photons pointing here with the proton pointing here, you get a net magnetizations effect. And once they are aligned with this, you can actually use the radio frequency pulse, basically apply a radio frequency pulse to make this proton to be in resonance. Then you can actually change the protons directions. So you can see that just now they are actually pointing along the main magnetic field. Now when you apply a radio frequency pulse, you can actually make them to change to point to a different directions. So once you have done this, then you can actually try to measure the hydrogen signal when they relax, because when they're being changed the directions using the radio frequency pulse, because you're still in the big magnetic field, these protons, they actually don't like to stay in the directions that you use the radio frequency pulse to change them. So they are trying to realign back with the main magnetic field. So when that happens, we call that relaxations. So when the hydrogen relax, they will actually release radio frequency wave as well. So then if you have a signal or you have a device to measure this, you can see that. So when the proton relax, they're going to release the radio frequency wave. So if you have a detector in these directions, then this detector will be able to pick up this relaxed signal, and then you can use a computer to regenerate this 3D MRI images of your body. So this is just a very brief introduction regarding how MRI actually work. So the area where there are more hydrogens, they are actually absorb and release more signal. So you can see that these MRI images have different intensity value. So these are the images represent different density of hydrogens in your body, depending on how many protons or how many water protons or how many fat protons in the body. If you have a brighter signal here, it means that you have a higher concentrations of the hydrogen proton in this particular part of your body. So this is just another example. This is just showing you a fetus in the body where you can see that there are different density in the body. So by showing by different intensity value in this image. So that is just a very short introduction regarding how MRI actually works. Before I go into the actual work, which is CEST MRI, just want to show a quick video to show you how powerful is the magnet in the MRI machines. Everyone hear the audio, hear the sound of the video. Anyone has I've stopped it now. Just now, can everyone hear the sound of the play video?
Yes.
Oh, okay, great. So I'll continue to play this. This is just a 2 minutes short video to show you how powerful is the magnet in the MRI scanner.
Whoa! So the force we're reading on that guy right now, just at that part of the magnet, is close to 300, 280?
Yeah, pretty good. Let's see what we can get.
Okay.
Now.
400 now.
And it's going to attach itself to the board here in a second.
Any second you can just start dropping, yeah. Gravity will just do enough.
There it goes.
There it goes. Oh, that's almost 600.
Now, it is giving us a reading of 500 pounds. Whew. $50, $560. Whoa. Ooh, ooh. We are at 700.
It's a medicine.
Yeah. 700 pounds.
Oh, it's fine.
Oh. And we have jumped to 1300.
Yeah, that's exactly right.
Yeah, we have
The
jumped.
most magnetic stuff is right here, still on top of the chair.
Whoa.
So we're just about to hit the sweet spot.
The
Okay.
wheel is sitting.
Oh, baby!
There we go.
Oh my god.
What are we on now? No, look at it, 1700.
We are at 1700, which is far more than this thing.
Can you just relax a bit now?
Yeah.
Okay, so the oh, 1800.
1800.
It's past 2000.
No, we got
There you go.
This
So this is just a short video to show you how powerful is the magnet in the MRI machines. We actually have to put your body inside to align all the protons in our body. So that is just a short video. Now we're back to what I want to discuss today. Basically, what is chemical exchange saturation transfer, CEST. So chemical exchange saturation transfer, CEST, magnetic resonance imaging, CEST MRI. So just now when I mentioned, usually when people talk about MRI, people talk about the hydrogen proton, or we call it water pool here. So conventional MRI technique, they always refer to the measurement of the hydrogen protons in our body. So what I want to introduce you today is CEST MRI. What is so special about CEST MRI is CEST MRI allow you to detect labile pool. In here, labile pool can refer to any protons in our body that has a concentration that is much lower than the hydrogen proton in our body. So in the previous few slides, already mentioned it to you, hydrogen protons make up about 83% of our body. So that's why whatever we measure conventionally using MRI, we are technically measuring the change of the hydrogen proton or water pool here. So this new technique, or not really new anymore, this CEST MRI technique allow you to detect protons in our, there are many different protons in our body. So one of the example that I can show you or mention about is actually the amide protons. So amide proton concentrations, when you compare it to the hydrogen or water protons in our body, is actually having much lower concentrations. But with this technique, you can indirectly detect this low concentrations proton in our body as well. So how this CEST MRI technique works is you apply the radio frequency pulse just like normal, but if you apply it at the Raman frequencies or resonant frequency of this labile pool here, then you're going to notice the saturated proton from this pool is going to have chemical exchange with the protons from the water pool. When that happens, you're going to see CEST effects appear in your G spectrum here. So we call this a G spectrum. Basically, the plotted water signal across different saturation frequency. Then when you have a slightly different pH in the body, and then you apply the radio frequency pulse to the resonant frequency of this labile pool, what you're going to notice is if you have a lower pH value, the exchange between these two groups of protons, it becomes slower. And then when you have a slower exchange, what you're going to observe is the CEST effect here becoming smaller. Then when you have a higher pH value in the body, the exchange between these two groups of protons will actually become faster. Then you see a bigger CEST effects around the resonant frequency of the labile pool here. So for this case, the resonant frequency of your labile pool is around this ppm, we call it. So in here is about 2 ppm. So there are actually many different labile pools in the body, some of them at 2 ppm, some of them at 3.5. And then depending on what type of low concentrations protons you are interested in. So for what I'm going to talk in the subsequent slides, I'm actually interested in the labile pool, basically the protons in the mobile proteins and peptide. So we call it the amide protons. It has a Raman frequency or resonant frequency at about 3.5 ppm away from water pool. So water signal is about here. Then the amide protons is about 3.5 ppm away from the water pool. So applications of CEST MRI in ischemic stroke. So before I go into how CEST can be used in ischemic stroke, I'm going to talk very briefly about what is ischemic stroke. Okay, so these pictures actually show a very good diagram of ischemic stroke. So ischemic stroke will happen when you have a blood clot stop the flow of the blood to an area of your brain. So basically, whenever the patient has a blockage, then the blood cannot go to a certain area of the brain, then we call that an ischemic stroke. So ischemic stroke is actually one of the leading causes of death and also permanent disability worldwide. And this is one of the reasons why I'm interested in using CEST MRI in ischemic stroke. So I did this in my PhD and also postdoc work in the UK, trying to apply CEST MRI in ischemic stroke to improve the ischemic stroke diagnosis in one of the hospitals in the UK. So how CEST MRI can be applied to improve ischemic stroke diagnosis. So before I go into application of CEST in this area, I want to talk something more about what happened in our body when you have impaired blood flow or reduced blood flow. So the percentage value here show the percentage of blood flow reductions. So if the reductions drop to 70% of normal blood flow, then you will start to see some changes in our body, especially our brain. You'll start to see that the cell will actually start to have proton synthesis. And then if it drop to 50%, it will be HSP72 expressions and so on and so forth. Don't worry about all these metabolic disturbance and also electrophysiological disturbance when the blood flow start to reduce. What I want to show you in this image is when the blood flow reduced to less than 20% of the normal value, then the cell in the brain will actually start to die. Okay, so if it drop below this this value, we will actually start to have ATP depletions. Basically, your cell will actually start to die, being indicated by the red area in here. So this red area here is what we call the infarct core. So this is the area of the cell that is going to die when a patient have ischemic stroke. Then you also notice there are actually a big white area outside the red area in the brain here. So this is the area that we call penumbra. Penumbra is the area that if you are able to restore the blood flow to the brain, then you will see that this white area, there's a possibility to save this white area of the brain. So as you know that your brain is the one that controls your whole body system or whole body functions, the more area of the brain that you can save, it can actually lead to a better recovery for the stroke patients. So this is the area that I'm interested in. So if you go back to look at this metabolic disturbance, you're going to notice that when the blood flow drops to about 40% of normal, then the cell will actually start to use the glucose to generate the energy. Okay, the glucose stored in the cell to generate the energy. And then when this happens, we call that anaerobic glycolysis. And then if the blood flow continue to drop without restorations, then you will start to see that the cell will have a lactate cytosis. Basically, you will start to observe the pH will actually drop. So if you look at this diagram again, you will notice pH drop actually happen below the cell actually, before the cell actually die. So which means that if you have a way to measure the pH changes in the brain, you can actually predict which part of the brain is actually under severe stress. Or indirectly saying that if you can measure pH drop or pH changes, you can predict which part of the cell in the brain will actually die if you do not do any treatment. Okay, so this is where CEST MRI come to the picture of ischemic stroke diagnosis, because pH changes happen before the cell actually die due to reduced blood flow. So if you can have a way to detect pH changes, you can have a way to predict which part of the brain is going to die. So why it is important to know which part, which area of the brain is going to die? First is brain is very important to control all the functions. Second is actually the treatment that the currently approved treatment, we call it thrombolysis, basically to break down the blood clot. There is a serious side effect of this thrombolysis treatment. So besides breaking down the blood clot, it can actually cause the patient to bleed in the other side of the brain. So if that happens, you are actually making the patient to die faster. So if you have CEST MRI applied in ischemic stroke, you can actually do the predictions. If you apply the treatment, how big is the area of the brain that you can save, then you can greatly increase the benefit of giving this thrombolysis drug to the patients. So if you see that there's not much pH changes in the brain after ischemic stroke, then probably it's not worth to give this thrombolysis treatment, because if the patient really bleeds, the chance for patients to die from bleeding is a lot higher than dying from ischemic stroke. So, sorry. just want to show you when we apply CEST MRI to healthy subjects, this is actually a pH map. So if you applied it to healthy subject, you can actually see that the pH map in healthy subjects is relatively homogeneous, around 7. Then when we apply this CEST MRI technique to hyperacute stroke patients, you can see that in the ischemic area, we notice the pH value is actually lower. So this is DWI here stand for diffusion weighted imaging. It's the standard MRI technique to identify ischemic stroke. You can see that these patients actually have an ischemic stroke around this area. And it shows that when we use this CEST MRI in this ischemic stroke patients, we can see that the pH value in the ischemic area is dropping. Although we do have some other artifacts in different area of the brains due to many other factors, but this is the first quantitative pH maps of acute stroke patients generated using CEST MRI. So this was published during my PhD time. People are getting excited because there's no technique that allow you to generate this high or high quantitative pH maps. So what people can do previously is they can only tell you what is the pH value in an area of the brain. So in this image, I'm actually able to tell you what is the pH value in each pixels of the MRI images. And then when we apply it in ischemic stroke patients, we can actually show that the pH value is actually lower in the affected area. Okay, then we further tried it. We conducted clinical trials of using CEST MRI in acute stroke diagnosis in one of the hospitals in the UK. Then this is what we noticed. So these are the images acquired during patient admissions. Basically, once the patient have the ischemic stroke, when they are sent to the hospital, we actually scan them using the MRI scanner. ADC here stands for the diffusion weighted imaging scan to show you the ischemic area is actually in here. This is one of the ASL here stands for arterial spin labeling. It's one of the way to show which area of the brain is actually having reduced blood flow. You can see that the reduced blood flow area is actually in this part. And then this one is actually the CEST generated images. You can see that the pH value in this part of the brain is actually dropping. So then we look at the result. This is the pH changes results. Then we try to compare it with what happened to the patients when the patient come back a month after they have the ischemic stroke. So this is what we noticed. When the patients come back a month after the ischemic stroke, this is the final infarct area. So basically, if the patient come back a month after that, there's all the cells that we can save, supposed to be saved. Then all the cells that cannot be saved should have become infarcted, basically die. So what we notice in this clinical study is pH map seems like fitting the theory that I showed you in the reduced blood flow diagram just now. If you see the pH changes, it can actually help us to do final infarct predictions or estimations. Then we submit this paper to one of the top neurological journals. The editor likes it very much and selected this as one of the editor choice. So we actually established the first proof of principle for clinical use of CEST MRI in patients, acute stroke patients. And then we actually show that cerebral intracellular pH can be potentially a marker for metabolic stress. Then it maybe can be used to predict eventual tissue outcome, basically what happened a month after the patient have ischemic stroke. Okay, so this clinical trial was still being carried on after I left UK. Then they have recruited a few hundred patients using CEST MRI in acute stroke. So that is how CEST MRI can be used in acute stroke setting to improve the penumbra estimations via the pH changes in the brain. CEST has also been used in cancer diagnosis as well. So let me, what is the time now? So I still have about 20 minutes, so I'll just go slightly quicker in this. So what is cancer diagnosis, or what is cancer cell? So you can see that this is a picture showing you what is a normal cells and what is a cancer cell. So if you can look at this, cancer cell, usually they are growing rapidly. Then when the time goes on, this cancer cell will actually outgrow the normal cell. Then what people have noticed so far is in cancer cell, this cancer cell are more glucose hungry because they have to grow rapidly. Then they actually grab a lot of glucose from our bloodstream. So how they actually do it is they have angiogenesis. Basically, the cancer cell here will have more blood vessels, so that more blood can go to this cancer cell area. Then they can actually grow faster. So this is one of the characteristics of the cancer cell. We call this Warburg effect. They are more glucose hungry. And then there are also some studies saying that cancer cells actually have higher concentrations of protein compared to the normal cell. And this is what I'm actually doing in Malaysia as well, trying to use CEST MRI in cancer diagnosis. So if you remember what I showed you after I talk about CEST MRI, CEST effects will be changed not only based on pH value changes. CEST effects can also be changed based on the labile pool concentration as well. So in this case, because in cancer microenvironment, pH value will change, and also there's a potential change in the protein concentrations. So if you apply CEST MRI in cancer diagnosis, you'll be able to see different CEST effects being measured using CEST MRI when you compare it to the normal cells. And one of the reasons why I'm interested in using CEST MRI in cancer diagnosis is because cancer is one of the leading causes of death worldwide as well. And compare it to acute stroke, it is a lot easier to apply CEST MRI in cancer diagnosis because in acute stroke patients, they are actually in a very critically ill conditions. So if you ask them to stay in the MRI scanner for 20 minutes, it is mission impossible, because if you are not staying still or perfectly still in the MRI scanner, whatever image you are getting, most of them cannot be used. But talking it to cancer patients, we find that cancer patients are usually more cooperative because they are not really in the critically ill conditions. Since they are more cooperative, we are able to get a better quality image. Then we can actually improve the cancer diagnosis as well. So in the following few slides, I'll show you how CEST MRI can be used in cancer diagnosis and how it can be used to improve cancer management. So this is one of the paper published in the early days by Hopkins. So what they have shown in this image is this is the conventional way of using MRI to detect cancer cell. So just want to show you image here. A in here is actually a radiation necrosis. What is radiation necrosis here is when this, just to tell you, this is not an actual human. So this is actually a rat brain. So they injected the cancer cell into this rat brain. Then after that, they use radiations to kill off this cancer cell. So meaning the cancer cell has been treated in this animal. But when you use conventional MRI techniques to scan them, so this one, all these are actually conventional MRI technique. Let me change the pointer to pen. So this is actually conventional MRI techniques to image the brain. So what they notice is the treatment actually they have performed the radiation treatment, and then all this cancer cell here has been treated. Then these are the two different cancer cell lines that they inject it to the animal brain. So they also notice the conventional MRI techniques show that if you have cancer cell for these cell lines in this part of the brain, you're going to show a brighter signal. Then this is another cancer cell line, not so aggressive. They're implanted in this part of the brain. Then you also show that there's a higher intensity value in this part of the brain. So what they notice in conventional MRI images is conventional MRI is not able to tell you the difference between radiation necrosis, basically after treatment, and also when this part of the area of the brain has a cancer cell. But when they try to use this CEST MRI technique, what they notice is if you have treated this part of the brain, then when you try to get the CEST MRI image, you will notice the intensity value in this part of the brain is actually lower. Then if this is a actual cancer cell area, it will actually show higher intensity value in the cancer cell area. And then if you have this not so aggressive type of cancer, you also see a slightly higher intensity value in the cancer area. So what I want to show you in this part is conventional MRI techniques will not be able to show the difference between treated and untreated cancer cell. But when you use CEST MRI technique, if it's treated and is successful, you will be able to differentiate the treated and untreated cancer area. So this is the CEST images. And then when they use the gold standard, clinical gold standard to show that the cancer cell has been treated properly, this is histopathological images. You can see that the treated image, there's no more blue color or purple color here. The untreated area, meaning there's still cancer cell in this part and there are cancer cell in this part. So it actually correlates very well with the CEST MRI images. And this is the reason why some of the medical community are actually quite excited, because this is one of the first things that people have shown. CEST MRI can be used to differentiate radiation necrosis and tumor regrowth. So this is a very complicated cases. So if the patients have regrowth tumor, then patients has undergo radiation treatment before. Using conventional MRI technique, they are not able to differentiate the two, but with the CEST MRI technique, they can. Okay, so move on to the next one. CEST MRI is also useful to predict the treatment response. So let me go through this quickly with you as well. So this is showing you the pre-treatment result. This is conventional MRI technique. This is the CEST technique. So if the treatment, this is pre-treatment, then bottom two are actually the post-treatment result. So let me show you, focus on this part first. Pre-treatment, when they try to use CEST MRI, they notice the value is smaller. Then 1 week post-treatment, if the value become even smaller, so darker blue color here meaning even smaller CEST MRI value. What they notice is it correlates very well with what happened a month after treatment. So meaning the tumor volume become even smaller. Then in the ineffective case, what they notice is pre-treatment, CEST MRI value is small. Then 1 week post-treatment, if they notice a bigger CEST MRI value, they find that it correlates very well with tumor volume increase. So basically showing you this is not working case and this is working case. So in not working case, you are going to see the CEST MRI value increases. So this is older paper to show that CEST MRI can be used to predict treatment response. Some of the newer paper actually show that CEST MRI can be used to predict treatment response within the first few days after treatment. So this is very useful because conventionally it's a bit difficult for a medical doctor to tell you whether your cancer treatment is successful or not. Usually they will ask the patients to go back first, then come back again a week or a month after they have done the treatment. So with the introductions or use of CEST MRI technique, you can note it within the first few days after the treatment, whether the cancer cell or the cancer, the treatment is working or not. This can greatly reduce or improve the treatment to cancer diagnosis, because if you see this kind of images a few days after you have performed the cancer treatment, you know that the treatment is not working. You can probably perform further treatments to kill the cancer cell. You don't need the patient to wait for few weeks or few months after that and then come back with a bigger tumor. So the earlier you can know whether the treatment is useful or working or not, the better we can actually improve or save the patients from these cancer complications. Okay, so another interesting use of CEST MRI in cancer diagnosis is usually MRI is not able to probe how active is the cancer cell in the body. So the gold standard to actually determine how active is the cancer cells in the body is using PET. PET is stand for positron emission tomography. So it's actually a radioactive diagnostic imaging. So you inject the radioactive glucose into the body and then let this radioactive glucose to go to the cancer cell and accumulate in the cancer area. As I mentioned earlier, cancer cells, they are actually more glucose hungry. When you give this radioactive glucose using PET, then cancer cell will grab more of them. You're going to notice in the PET images, whichever area that have cancer will have higher intensity value from the PET images. So this is what people use to probe the metabolic activities of the cancer cell. But with CEST MRI technique, what people have noticed against this is this paper was published by a research group in Johns Hopkins University. What they noticed is instead of using radioactive glucose, they can use normal glucose with CEST to do this metabolic imaging as well. So what is the advantages of this CEST MRI technique compared to PET is, when you're using natural glucose or normal glucose, this is not radioactive. And then in PET, they are actually using radioactive glucose. So what is the bad thing about radioactive glucose is, if you use it too much and too often, it can actually cause the subject to have more cancer. So if you are exposed to radioactive material more frequently or in a high concentrations, then the chance for the subject to develop cancer is getting higher. So with CEST MRI technique, you can actually use normal glucose to do this metabolic imaging, basically to probe how active is the cancer cell in the body. So this is the images to show you people are acquiring the CEST MRI images continuously. So they give normal glucose through infusions to the cancer patients. What they notice is, as the times goes on, it can actually show the metabolic imaging informations that is conventionally only being provided by PET imaging. So you can do the same thing using CEST MRI by giving normal glucose molecule to the patients. You can see that this is the time GIF animations of how the glucose molecules are being taken up by different areas of the brain. So you can see that cancer area is here. You can see slowly this part of the area is actually showing high consumptions of natural glucose. So means that if you use CEST MRI technique, there is a potential to replace it with PET imaging. Then in the future, you do not need to use radioactive glucose to probe how active is the cancer cell in the body. So, which means that any things that has high concentration of glucose, such as some of the images in here, may potentially be used for future cancer cell diagnosis. Okay, so in the future, you probably just need to take these high glucose concentration drinks, Monster, or take a lot of chocolates before you go into the MRI scanner to probe how active is the cancer cell in the body. So do not need to use PET, which give you radioactive glucose, inject it to your body to try to probe how active is the cancer cell in the body. Okay, so this is what I'm trying to do in Malaysia. We are running a clinical trial with one of the hospital here, and we'll try to report back and publish the result when we have more concrete outputs coming out from the clinical studies. So what is the time now? Still have about 12 minutes. So just give a quick summary regarding what I've talked about in the past 45 to 50 minutes. CEST MRI has a great potential in stroke and also cancer diagnosis. And then there are actually many things that we can explore using this CEST MRI technique. It has the potential to change how stroke and cancer can be diagnosed and also managed clinically. So with that, I end my presentations and then open to the floor for Q&A. So if you are too shy or interested to discuss or ask me anything, you can send me an email via this email address. It's basically my name @gmail.com. So with that, thanks a lot for listening. Open to Q&A now.
Thank you, T.
Hi, Tony.
I have a question. I have a question.
Yeah, sure.
When you were on the first part, when you were talking about the application and you were looking at the pH, I noticed that you also were talking about, or the slide highlighted anaerobic glycolysis. And I was just wondering whether that is also a potential, signal in essence, or the signal is, why is that highlighted there?
Yeah, because when you have reduced blood flow to a certain part of the brain, the cells still have to survive. So how the cells survive is basically using the stored glucose in the cell. So this is what we call the anaerobic glycolysis process. And this is a very ineffective way of generating energy for the cell, because if you have oxygens and then you have glucose, you can generate 36 ATP. Then if you don't have oxygens, you only have glucose, you can only generate 2 ATP. ATP here stands for the energy for the cell. Then because you have ischemic stroke, you have reduced blood flow, then you have this anaerobic glycolysis, which is a very ineffective way of getting the energy. The byproduct is actually this lactocitosis, going to cause a pH changes. So,
okay. Yeah. So the anaerobic glycolysis leads to eventually the pH drop.
Yeah.
So you do have to wait for the pH drop in order to have the signal.
Because yes, you're right. So why I'm interested in this pH drop is it is actually a stage before the cell actually dying. So if I can measure this accurately, I can actually predict which part of the brain is going to die. Then I can actually inform the clinical doctors whether they should do the more invasive treatment to the ischemic stroke patients or not. Because in some of the ischemic stroke patients, what we notice is pH changes is actually very small. For example, only like this. Then you already have most of the area of the brain already dead. So there's no point to give this thrombolysis treatment to the patients because it can cause the patient to bleed also. So if you notice the pH changes is actually very big compared to the area of the cell that already dead, then the benefits of giving the patients the treatment is a lot higher than the risk. Then the medical doctor should actually go inside and do something or give the drugs to the patient.
All right, thanks.
I have a quick question.
Yep.
Have you noticed any difference when you're using the CREST on tumors, regardless if they are malignant or benign? Do they have like a different pH value that you're able to tell? Or
yes, so I didn't put this in because I only have a 1 hour talk, but I have it here. So thanks for the questions. What you can see from this table is you have, if I think some of you probably know that cancer will have a different grade. You have grade 2, grade 3, and grade 4 cancer. So what I want to highlight here is the CEST MRI value will be different when you have a different grade of tumor, or when the patient have different grade of tumor. Grade 2 is the benign tumor, so not so serious. Then you can see that the CEST MRI value is slightly smaller. Grade 3 is actually more aggressive type of cancer. You can start to see that the CEST MRI value increases. Then grade 4 is actually the most aggressive type, metastatic cancer, which already spread to different parts of the body. You can see that the CEST MRI value is actually getting even bigger. So by just looking at the obtained value, there's a way for you to do tumor grading. But the current gold standard is still histopathology. What is this is they will go inside the cancer cell area, take a small tissue out, and then look at it under the microscope to decide what is the grade of the cancer. But with CEST MRI technique, there is a potential to do it non-invasively. You just scan the patient using MRI scanner. You do not need to go inside the brain and take a small piece of tissue out. One of the main issue with this histopathology is when you go inside the brain, you may not be going into the area that is most aggressive. Then when you remove the tissue out and look at it under the microscope, there is a possibility of making a wrong diagnosis because you are actually removing the cell that, removing the not the most active aggressive cancer cell. Then supposedly the patients have grade 4 cancer because the tissue you remove probably only have grade 2, then a wrong diagnosis is being made. When you use CEST MRI, you get the 3D volumetric image, so you can see the whole brain area. You can actually get more accurate tumor grading potentially. Did I answer your questions?
absolutely, that's incredibly impressive. And thanks for your talk. It's very informational, I guess.
Thank you. Any other questions from others?
Tony, I think in the chat room, and there is a question.
In the chat room,
Yeah.
let me see if I can.
Can you see that?
I
From
probably have to
Eric
stop
Rosen.
the sharing. Oh yeah, I can see the chat room now.
Okay.
Great. Why do some of hydrogen line up 100 degree? Can you explain a little bit further about the labile pool? What is it? Okay, so let's go back. So first question is, why is 180 degree difference? Because hydrogen proton has two states. So when you put them under a very powerful magnet, they can only either align with the main magnetic field or against the main magnetic field. So this is the fundamental physics. So they can only be in these two stages. One is align with, so align with your main magnetic field or against the main magnetic field. So if you ask me what is the reason, so I also cannot explain because this is fundamental physics. This is what they have observed. When the hydrogen proton in a very high magnetic field area, they will be either aligned with or against the main magnetic field. Then second questions is, can't remember, let me see what is second questions again. So second question is explain a little bit more about labile pool. Okay, sure. So labile pool here refer to, let me see. So labile pool here refer to any other protons in the body that have lower concentrations than the water pool. Water pool that I'm actually referring to H+ here. As I mentioned earlier, about 83% of our body are actually consists of hydrogens, protons. Then there are actually many other molecules in our body as well. For example, we have OH, we have NH, 2H. So we have amide, amines. Basically, there are actually many different types of molecules in the body. Conventionally, when you use MRI, we are not able to see all the others molecules because this is too dominant. So basically 83% of it, that's why the signal actually mainly coming from these hydrogens protons. So labile pool here referring to any other protons in the body that has lower concentrations than the hydrogens proton. And then all the things that I'm talking about in cancer and also in stroke, I'm actually talking about the amide protons, which have a concentration that is much lower than the hydrogen proton or water pool here. So what these amide protons is actually NH2 or N2H. Okay, it has a resonant frequency at about 3.5 ppm here. And then whatever result that I've shown you in stroke and also the cancer diagnosis, they're actually looking at the changes of amide protons in our body, which is which you can find a lot in the mobile proteins or peptides in the body. So hopefully I've answered you what is mean by labile pool here, meaning molecules that appear in our body but have concentration that is a lot lower than the water protons. But we find that this labile pool, especially the amide protons, give us additional informations regarding cancer and also stroke diagnosis. If we make use of them, we can actually improve the cancer and also the stroke management clinically.
Thank you very much for your answer. It's the talk was wonderful.
Thanks for that. Any other? No more. I think I've answered Eric regarding this.
Hi T, I probably have a general question. You mentioned quite a lot about the advantages of the new MRI techniques, and which CEST, you call it them. And is there any something like this disadvantage compared with the CEST MRI compared with the traditional MRI?
Disadvantages. So far, compared to conventional MRI technique, there's no disadvantages because this is still a type of MRI technique. The only difference is they tweak the sequence. So sequence here referring to the software they write to the scanner, how they acquire the data. They just change the sequence slightly to pick up this CEST informations. So technically, whatever advantages and disadvantages of conventional MRI techniques, CEST MRI technique will have. So The only main difference is it gives you extra informations, like it can give, CEST MRI can give you the pH informations and also the protein informations that is not available in the conventional MRI technique. But when you talk about disadvantages, they are actually having the same disadvantages. For example, any patients with metal implant, they are not able to get this MRI scan, because if they have any metal implant, I think you still believe, still remember the video I showed it to you. If they have any metal implant, that metal implant will actually fly out immediately when you go near to the scanner. I think they have shown you a few crazy experiments by throwing a few metal checks and also some of the metal materials to the strong magnet. The strong magnet is able to destroy them instantaneously.
Okay, thank you.
So I think I've spent a little bit more than 1 hour. Any other question? If you have, please feel free to send me an email. So my email is basically just my name @gmail.com. Thanks a lot for listening to the presentations. So keep in touch, and thank you, Goyi and Tony, for the invitations. Thank you so much, everyone.
All right, T,
Time
thank
to
you.
go back to sleep.
Very good talk, very informative. Thank you.
Thank you so much. Thank you, Tony and Goyi. So keep in touch. Stay safe, everyone. Have a good day.
Have a good
Thank
day.
you.
Goodbye.
Bye-bye.